second speaker in this evidence briefing session is Catharine Ward Thompson. Catharine has already introduced herself, but I'm going to do it again. Catharine is the Professor of Landscape Architecture at the University of Edinburgh. She's the Director of the Open Space Research Centre, and her work looks at what hinders or enables access to the outdoors for different groups, including older people and children and teenagers. She's also currently working on a large multidisciplinary study on pedestrian mobility for older people called Mobility, Mood and Place. So it's Catharine Ward Thompson. Thank you.
Thank you. I'm going to stand. I'm concerned that everyone can hear me well, so I'm going to stand here to take advantage of this microphone. Is that okay?
Yep.
You can hear me. Thanks to Chris for a great introduction to age-friendly cities, and I'm now going to talk a bit more on the environmental side of things, which is where my expertise lies, and give you a bit of a dash through some things that you're probably familiar with, some things you might be less familiar with. We will make the slides available at the end. I haven't been as well behaved as some of my other presenter colleagues, and I'm afraid I haven't given you the handout in the pack at the start of today, but the slides will be available afterwards if you want to look any of the references up. So I'm interested in the idea of supportive environments, environments that don't obstruct us, that aren't designed unthinkingly, so that they make problems where we don't need problems. Ideally, we want environments that are positively designed to support us into old age. But often there are obstructions that either don't need to be there, or if they need to be there, are not designed in a sensitive way. So that's what I'm interested in. And a lot of the evidence I'm going to talk about comes from a multidisciplinary and multi-university research project that went on for a number of years. I'd go outdoors if I could, wouldn't you? That's the acronym, Inclusive Design for Getting Outdoors. And I worked with colleagues in Salford University and Warwick, and I'm delighted that Lynn, who is speaking to you later on, was one of those colleagues from Warwick, as well as colleagues from Heriot Watt. So some of our early evidence just was gathering good empirical evidence to persuade policymakers, planners, whoever, of sound basis for concerns about the quality of the environment. And one of the first things to say is that we all use the pedestrian environment. If we have a car, we still use the pedestrian environment at either end. If we're a wheelchair user, we use the pedestrian environment. So the pedestrian environment is important to all of us, and if we don't get that right, it's very hard for us to get about and to enjoy the outdoor environment. And of course, if we are economically deprived, if we have problems finance-wise, then we're much less likely to have access to a private car, much more dependent on the public domain. So getting the pedestrian environment right is really important. And of course, a poor quality urban environment and a poor quality pedestrian environment can exacerbate the other problems we may have if we're living in economic deprivation or we have other problems in our lives. Concerns about safety, concerns about noise, traffic noise, the pollution, these things can just be added stressors in our urban environment. They're not necessarily the main cause or our main focus of problems, but they add to it in a way that just reduces quality of life and may in the end mean we don't feel like going out at all. Some of the next few slides you will be very familiar with if you've been working with age-friendly communities and looking at age-friendly environments, but it still sometimes needs saying. Particularly for those of us who are designers, we love designing exciting, interesting paving, but our older participants tell us, just keep it plain, Catherine. We don't want fancy paving that's going to trip us up or be visually too jazzy and make it difficult for us to perceive where changes in level or slopes are. So, yes, there's an opportunity for good and innovative design, but keeping it smooth, simple, not likely to trip us up is very important. We've done a project with colleagues in Salford Go Far where we went on walks with people who had fallen in the outdoor environment. And it was very interesting finding out where problems were, cracked paving, an obvious one, as you might imagine. It was also interesting that with some of our participants, We went outside on the route that they had gone when they fell with their agreement, obviously, and they said, this is the first time I've ever been past this point. I fell here before and I've been frightened of going out again. But now you've come with me, I feel I can go on beyond it. That's a weight off my mind. So there's a whole social component as well, and an issue of social support in relation to falls and fear of falling. Something that keeps the traffic from us, something that makes an attractive environment when we go out is important. We don't just want an environment where we can get out and about. We want an environment where we enjoy getting out and about. Somewhere that keeps the traffic away, or if the pavement is close to the traffic, it's light, that heavy traffic can be a real problem. Many of you will know about this, but it still needs to be said. We need seating, not just at destinations, but on the way to them, so that if we feel tired on the way to a destination, there's a place to rest. It doesn't always have to be a formal bench, it might be an informal perch, but it's somewhere where we can stop and rest. We need clear, simple, easy to read signage. The slightly fuzzy one on the left you may not be able to work out, that's my bad quality photograph. It was nice in principle. It was a place in Australia actually where they were trying to point out that there were public toilets in both directions, but if you needed one urgently, what it didn't tell you was which was the closest one, which seems to be the vital bit of information. But yes, public toilets really important. Changes in level, options, again, we're very familiar with this now, but sometimes we get offered an either or. The stairs get taken away and there's only a ramp. Well, if you have certain kinds of proprioceptive problem in walking, then actually a stair with a good handrail may be easier to use than a ramp. So we need both and, not either or. Crossing points and challenges of changing the style of crossings. I don't know how many people here are familiar with the puffing crossings that we've been introduced in the UK recently. But people used to have a green man in front of them when they crossed the road, and then there was a stage when a new crossing had a green man beside you before you crossed the road, but there was no green man in front of you as you crossed the road. Now, nobody had told most of us that there was an electronic eye within that system that would note when we were still crossing the road, and the traffic would be kept stopped until we got to the other side. So we've got people walking along trying to look at the green man behind them to see if it's still green while they're on the road. Everyone feeling very anxious about that, much more likely to trip over. It's a classic example of a design designed to be better than previous, but actually where the information given out to help us use it better was not adequate. Bus stops and shelters, you know, we need seating in those too. The illustration my colleague from Salford got up on the right is a rural bus shelter on Skye, where the local people had just brought their own chairs in because the wheelchairs there. So, you know, good community activism there. And public toilets, I've mentioned that before. Ones that are open, the good news is the one on the left has been reopened since this slide was taken. And preferably accessible. The one on the right is one in Edinburgh, but not very easily accessible. But people really do want to get out and about. And these are some nice quotes gathered by my colleagues. It's psychological. People feel better about engaging with the natural environment if they've been able to get to a park or green space, engaging with this change in seasons. All of this is good for us physically, psychologically. Getting out into the sunlight and the daylight is very good to help us manage our circadian rhythms. That means we sleep better at night. It helps us with our vitamin D, calcium in bones, all of these things. So getting out and about is important for our health and well-being in multiple dimensions. And some of the work in open space, my own research centre, as part of the IGO project, was involved in producing empirical evidence to persuade policymakers that it really does make a difference to physical activity, health and quality of life if people have an environment that makes it easy and enjoyable to get outdoors. And we also looked at the importance of close access to a good open space, a green environment, a park, a natural space that's easy to use. People who lived within 10 minutes walk of a local park were twice as likely to achieve healthy levels of activity as people living further away in our sun. And they were more than twice as likely to be satisfied with life in general, and also quality of life and well-being measure if they live within 10 minutes walk or less of a local park. Good paths on the way to the open space are also important. Again, good paths were associated with people being more likely to achieve healthy levels of walking and physical activity. And in the light of that news I mentioned at the start of today, a really depressing statistic, people living in sheltered accommodation or care homes in the sample were nearly 3 times less likely to get outdoors for more than 5 hours per week than people living in their own homes. And that news just this morning emphasises that people in care homes don't always have good access outdoors at all, and this can be detrimental to many aspects of their health and well-being. This is, I'll go quickly through this, this is a method we use to try and explore trade-offs, alternatives. I can explain more of the detail, I don't have time for it now. But what this allows us to do is to look at what preferences people have if they have to choose in complex contexts where you can't necessarily get everything just right. You can't get everything as you would like it. So if you had to choose between having less traffic or more trees, and people like less traffic and they like more trees, then traffic trumps trees. Less traffic in this scenario modelling was more important. Participants would prefer that, and they would give up having lots of trees to have them. But trees versus facilities, people would give up some aspects of facilities such as the cafe with toilets to ensure that they have tree-lined paths to their park and attractive trees and plants within the park. And again, we know that good maintenance of open space is really important, and people care about that, but an aesthetically pleasing place is more important than maintenance alone. So we don't want a beautifully maintained, deadly dull space that doesn't have attractive trees and shrubs and wildlife and water features within. And some recent work we've done looking at changes to residential streets shows that, again, the same messages. Access to outdoor and particularly natural environments seems to make a particular difference to quality of life if you're in a deprived community. Interestingly, even if you're a car user, getting outside at all is a predictor of physical activity levels. So one of the things we know we need to do to maintain good health into old age is we need to keep active, use it or lose it. And even if you're a car user, if you have access to the car, it's getting out of the house at all that means we're more active. So that really is very important. The quality of the street in terms of physical environment didn't seem to make as much difference to our participants in a recent study as the wider neighbourhood environment and environmental factors on the neighbourhood scale rather than just the residential street. So that's an important message too, and perhaps underlines some of the things that Brian was talking about earlier on. Many of these do relate to green and open space and access to them. My colleague Lynn and her colleagues were particularly concerned with private and semi-private open space, and garden space is under threat in policies to promote denser urban environments. So we need to make sure that we don't completely eliminate opportunities for everyone to have a bit of green space outside the home that you can go and sit out in when the weather's fine. And front gardens are very good for social interaction. This interface between our private home and public space, a place where we can feel secure, but we can spot someone going by, maybe have an informal conversation, see what's going on. These are very important, and design of these is something that architects, landscape architects, urban designers can really make a difference to. And we know that if we have a supportive environment, it is possible, and we have some wonderful participants in our research and some of our models here who show that they can have a very active and healthy and engaged life well into their 80s and beyond if they have the right kind of supportive environment. So to summarise, what we know, the pedestrian experience is really important. Transport, other things are important too, but this is really vital. Poor quality environments can exacerbate all kinds of problems, from socioeconomic deprivation to false risks and social isolation. And we now know that social isolation is as much of a physical health risk as many other kinds of physical problems. A supportive environment can benefit us in many ways, mental health as well as physical health, social well-being. Living within 10 minutes walk of a local park or green space makes a big difference to how active we're likely to be and our satisfaction with life. And people living in care homes do not have good quality access to outdoor environments that is available to them regularly. In many cases, this is something we need to pay attention to. I stole this bit of evidence from my colleague Ian Deary, a psychologist who's working with me on my latest project. Physical exercise apparently has more benefit to your brain than mental exercise. So being physically active outdoors actually may be better for us than doing that crossword or Sudoku. And an accessible outdoor space in our home and a green view is also really important for our well-being. So things to think about, that's what we know, plenty of things we don't know. We know globally our population is ageing and there's a challenge worldwide in how our megacities are going to cope in supporting citizens into very old age, and Chris has mentioned this already. He's mentioned the World Health Organisation's Age-Friendly Cities Guide. We're pleased that some of our research from the IDEAL project has informed that. And just to mention finally of a project that I'm engaged with at the moment called Mobility, Mood and Place, looking how we can work collaboratively with older people, including people with Alzheimer's and stroke survivors, to make mobility easy and crucially enjoyable and meaningful for older people wanting to get out and about in their local environment. Thank you.